An ectopic pregnancy is when a fertilized egg implants outside of the womb. And the signs of an ectopic pregnancy are normally seen between 4 and 12 weeks of pregnancy. Some of these are similar to symptoms of a miscarriage. So you may have vaginal bleeding, so you'd notice blood in your knickers, tummy pain, and it would often be low down on one side. You might also have pain in your shoulder. So that would normally be where your shoulder ends and your arm begins, so up here. And sometimes you might feel discomfort when going to the toilet, either for a wee or a poo. If you have an ectopic pregnancy, the most serious thing that can happen is your fallopian tube can rupture, it can burst because the pregnancy has got too big for that space. And that can mean that you have a really sharp, sudden and intense pain in your tummy. And you can also feel sick, feel very dizzy, or you can even faint. If you think you may be having an ectopic pregnancy, it is a medical emergency that can result in death. So it's very serious and you should definitely seek medical treatment. You can seek treatment by going to accident and emergency, or you could phone your GP surgery, but I would only do that if you think you'll be able to speak to a doctor very, very soon. If you're feeling very, very unwell, you should be phoning 999. This is very serious, and it would be better to have an ambulance come out and take you to hospital when it isn't an ectopic pregnancy than for you to have very serious complications at home. When you go to hospital with an ectopic pregnancy, you will usually go into something called the early pregnancy unit. We have another video about the tests that they do in the early pregnancy unit that you might want to watch. If you're diagnosed as having an ectopic pregnancy, there are 3 treatment options available in the UK. So the first is called watchful waiting. And this means after they've done some tests, you'll be allowed to go home. So you won't stay at the hospital. And normally you'll have to go back 2 days later and they'll do another blood test. And that's making sure that your pregnancy hormones are going down so the pregnancy isn't still growing. If you're sent home, they should give you painkillers that are stronger than the ones you can buy from a pharmacy. And they should always give you a phone number so you can phone the hospital back if you start to feel very unwell or have an increase in pain. The second treatment option for an ectopic pregnancy is called medical management. And this means they'll give you some medicine called methotrexate, and that will make your body start to get rid of the pregnancy. So you'll feel some cramping and the pregnancy will pass through your vagina. So you'll need some pads to catch that pregnancy as it comes out of your body. This option may not always get rid of all of the pregnancy. So the third option is surgical management, and you may be offered this after watchful waiting or medical management. Now, this means that you would have a general anaesthetic, so they would put a little tube in the back of your hand to give you the medicine, and they would do a procedure to remove the pregnancy. So you would go into an operating theatre, you would be completely asleep from the anaesthetic, and they can either do the procedure through what's known as keyhole surgery. So they'll make 2 or 4 small cuts in your tummy that they can put instruments in through and do the procedure that way, or they may make a larger cut in your tummy to remove the pregnancy that way. After the surgery, you would then come around in hospital, so you'd recover from the anaesthetic, and you may be asked to stay in hospital for a little bit longer, or you may be allowed to go home that day or the next day.